Stop what you are doing right now. I want you to walk into your kitchen, open your pantry, and pick up that box of cereal, that packet of instant oatmeal, or that loaf of whole grain bread that you have been dutifully eating every single morning. Look closely at the packaging. Do you see a red heart symbol? Do you see a check mark claiming it is heart healthy? I want you to look at that symbol and realize exactly what it represents. It does not represent safety. It does not represent science. It represents the single greatest deception in modern medical history. That symbol is the mark of the enemy. It is the seal of approval on the very mechanism that is slowly cementing your arteries, destroying your kidneys, and driving your blood pressure into the danger zone. The breakfast you have been conditioned to believe is the gold standard for health, the low-fat, grain-heavy, fruit-sweetened start to your day, is the primary reason your blood pressure medication dosage is increasing, not decreasing. You are doing everything right according to the guidelines. You are following the rules, yet your body is failing. This is not a coincidence. It is a direct cause and effect relationship that has been buried under decades of bad science, aggressive marketing, and a fundamental misunderstanding of human physiology. We need to identify the true enemy immediately. The enemy is not your age. It is not your genetics. It is not bad luck. The enemy is a script you were handed 30 years ago that is actively fighting against your biology. You have been told to fear salt, yet you were instructed to eat the very foods that lock salt inside your kidneys. You have been told to fear natural fat, yet you are eating the processed carbohydrates that turn your blood into a thick, syrupy sludge that your heart has to struggle to pump. High blood pressure is not just a dry number on a monitor that you manage with a pill. That number is the sound of your vascular system screaming under pressure. It is the physical sign that your internal pipes are narrowing, stiffening, and waiting to burst. When your doctor tells you your pressure is high, they are telling you that the structural integrity of your life support system is compromised. Today, we are going to tear up that outdated script. I am going to show you the biological mechanism, specifically how a healthy morning spike in insulin creates a hydraulic crisis in your kidneys, and I will give you the exact protocol to reverse it. This is about saving your life from a mistake you didn't even know you were making. To fix this, we have to stop treating the symptom and look at the crime scene inside your arteries. For decades, you have been told that salt is the villain. Doctors say cut the salt, so you eat bland, cardboard-tasting food, yet your pressure remains sky-high. Why? Because salt is just the passenger. Your blood vessels are the road. And your breakfast is destroying the road. When you eat that toast, that oatmeal, or drink that juice, you are not just getting energy, you are flooding your bloodstream with a tidal wave of glucose. Visually, I want you to imagine these glucose spikes not as soft clouds of fuel, but as microscopic shards of glass. As they rush through your system, they do not float harmlessly. They tumble along the delicate inner lining of your arteries, known as the endothelium. This endothelial lining is one of the most important organs in your body, although we rarely treat it as such. It should be as smooth as Teflon, allowing blood to glide without friction. It is coated in a microscopic, hair-like structure called the glycocalyx, which acts as a shield. But the glucose shards from your healthy grains scratch, tear, and abrade this lining. They strip away the protective glycocalyx, leaving the raw tissue exposed. Your body panics. It cannot leave these cuts open or you would bleed internally. So it initiates an emergency repair protocol. It rushes to patch the damage. It recruits white blood cells and uses a combination of cholesterol and calcium to plaster over the cracks. We call this plaque, but think of it as cement. You are taking a flexible rubber hose that can expand and contract with every beat of your heart, and you are coating the inside with layers of concrete. The vessel becomes rigid, it stiffens, it loses the ability to expand. The space inside gets narrower, the pressure builds. This is not aging. This is a continuous, self-inflicted injury caused by the very foods you were promised were safe. Every morning, you re-injure the wound, and every afternoon, your body lays down more cement. Eventually, the pipe becomes so narrow and brittle that it cannot handle the flow. That is the moment of catastrophe. Now we must go deeper, to the mechanism that almost no standard checkup covers. This is the aha moment that changes everything. You cannot talk about blood pressure without talking about insulin. Insulin is not just a blood sugar hormone, it is a master signaling hormone that gives direct orders to your kidneys. Here is the chemical reality. When you eat carbohydrates, even the healthy ones like oatmeal, your blood sugar spikes. Your pancreas floods your blood with insulin to manage that sugar. But while insulin is shuttling sugar into cells, it travels to your kidneys and turns a specific key in the nephrons, the filtering units of your renal system. It stimulates the sodium glucose transporter 2, or SGLT2, and other ion channels to stop filtering sodium. It effectively locks the exit doors. This is the trap. You could be on a low-salt diet, eating almost no sodium, but if your insulin is high from your breakfast, your kidneys will hoard every single milligram of salt you currently possess. They will recycle it back into the blood instead of urinating it out. And here is the physics of the situation. Where salt goes, water follows. Your body holds on to fluid to dilute the salt. Your blood volume increases. Imagine a water balloon. If you keep filling it with water, the pressure on the rubber walls increases until it bursts. By keeping your insulin high, you are literally flooding your own engine, increasing the hydraulic pressure inside a system that is already stiff and calcified from the glucose damage. You are stepping on the gas, fluid volume, and the brake, stiff arteries, at the same time. This is the recipe for a blowout. If you have been rigorously cutting salt, but your pressure is still dangerously high, you must understand that salt is not the root cause. Insulin is the jailer keeping the salt inside you. We need to remove the ambiguity. The term healthy breakfast has been weaponized against you. Let's look at the specific items on your table that are triggering this cascade. These are not food, they are metabolic disruptors. The first offender is instant oatmeal. Marketing calls it heart healthy because of a small amount of soluble fiber. Biology calls it a glucose injection. Because instant oats are pulverized, steamed, and processed, the cellular structure of the grain is obliterated. It requires almost no digestion. It hits your bloodstream with the speed of a candy bar. Within minutes of eating it, your blood sugar skyrockets, your pancreas screams, and the insulin floodgates open. You have just commanded your kidneys to lock down sodium for the next 6 hours. You think you are clearing your arteries. You are actually pressurizing them. The second offender is orange juice. This is perhaps the most dangerous deception in the American diet. We treat it as a health tonic, but it is liquid liver stress. When you strip the fiber from the fruit, you are left with a concentrated dose of fructose. Unlike glucose, fructose is processed almost entirely in the liver. This overload generates uric acid as a byproduct. High uric acid is not just about gout, it is a vascular poison. Uric acid directly inhibits the production of nitric oxide. Nitric oxide is the gas that tells your blood vessels to relax and open. By drinking juice, you are chemically clamping your own arteries shut while simultaneously spiking insulin. It is a double tap to your heart health. You are drinking a solution that tightens your blood vessels while increasing the volume of liquid inside them. The third offender is whole wheat toast. For many, the gluten and industrial processing create inflammation in the gut lining, a condition known as permeability. But beyond the gut, the carbohydrate load is massive. 2 slices of whole wheat toast can spike blood sugar higher than a sugary snack bar. This creates amylopectin A, a superstarch that digests rapidly. This systemic inflammation sends stress signals throughout the body, further tightening the vascular walls through a process called vasoconstriction. You are eating a sponge that soaks up fluid and creates inflammatory fire throughout your vascular tree. Try this immediately. Go to your pantry and check the label on your healthy breakfast box. If it has more than 15 grams of carbohydrates and less than 5 grams of fiber per serving, you must stop treating it as a meal. It is a dessert. and it is poisoning your pressure control mechanism. We have identified the poison. Now we deploy the membrane repair kit. The objective of the rescue protocol is to force your body from storage mode into repair mode immediately. We are going to switch the fuel source to lower insulin and unlock the kidneys. The champion tool for this tactical repair is the egg, specifically the yolk. You must stop fearing the yolk. The egg yolk is not the enemy. It is the raw material your body is desperate for. It is loaded with choline, healthy fats, and vitamin K2, the exact mortar your body needs to patch the scratches on your arterial walls without using calcium cement. Vitamin K2 found in pastured yolks actually helps direct calcium out of the arteries and into the bones where it belongs. It is the traffic controller for calcium, ensuring your arteries stay soft while your bones stay hard. But you cannot eat it alone. You must engage a fat anchor. This is half an avocado or handful of walnuts. Here is the mechanism. When these fats hit your stomach first, they trigger the release of cholecystokinin, CCK. This hormone slows down gastric emptying. It tells your stomach to release food into the intestines slowly. By anchoring your meal with fat and protein, you turn the violent glucose spike of your old breakfast into a flat, calm line. No glucose spike means no insulin spike. No insulin spike means the kidney lock never engages. The exit doors stay open. Your kidneys begin to filter properly, flushing out excess water and sodium naturally. The pressure drops because the volume drops. Diet is the foundation, but we need a chemical ally to actively force the vessel walls to relax. We need the biological opposite of sodium, potassium. While sodium creates tension and stiffness, potassium acts as a vasodilator. It creates an electrical gradient across the cell membrane of your arterial smooth muscle, physically forcing it to unclench and widen. It relaxes the pipes. But here is the problem. Modern agricultural soil is depleted, and processed food is devoid of potassium. A banana is useless here. It has too much sugar, which triggers the insulin problem we just fixed. You need 4,700 milligrams of potassium a day to see results. You would need to eat 12 bananas to get that, which would destroy your metabolism. You must flood your system with leafy greens, spinach, Swiss chard, beet tops. These are potassium powerhouses. Or use a pinch of cream of tartar in water, which is almost pure potassium. These minerals soak into the stiffened tissue and signal it to soften. This is not just nutrition, it is hydraulic engineering. You are manually overriding the tension in your blood vessels. However, I must issue a critical safety warning. If you are on blood pressure medication, specifically ACE inhibitors or potassium-sparing diuretics, or if you have kidney disease, you must consult your doctor before increasing potassium. This mineral changes fluid dynamics powerfully, and your medication dosage may need to be lowered to keep you safe. Do not play chemist without medical supervision if you are on prescription drugs. We have the fuel right. Now we need a mechanical trigger to burn off residual sugar before it touches your artery walls. We are not calling this a walk. We are calling this the glucose dump. Here is the mechanics. Your leg muscles, the quadriceps and glutes, are the largest glucose vacuums in your body. When you sit after eating, the sugar rots in your blood, creating those glass shards we discussed. But if you move for just 10 minutes, the physical contraction of the thigh muscles forces open a specific side door in the cell wall called the GLUT4 transporter. This door sucks glucose out of the bloodstream without needing insulin. It bypasses the pancreas entirely. This is critical. By engaging the glucose dump immediately after eating, you prevent the insulin spike from ever happening. Less insulin means your kidneys remain in flush mode. You are physically wringing the sugar out of your blood before it can cause damage. We are not talking about cardio. We are not talking about sweating. We are talking about mechanical activation of the GLUT4 pathway. Even standing up and doing slow squats or walking around your living room works. There is one final advanced strategy that supercharges this healing process. It involves the timing of your meal. We call this the delayed start. When you wake up in the morning, your body naturally spikes a hormone called cortisol. This is the cortisol awakening response. It is designed to wake you up, mobilize energy, and raise your blood pressure slightly to get you out of bed. This is natural. However, if you eat a high-carb breakfast at 7 a.m., right when cortisol is peaking, you are adding metabolic stress on top of hormonal stress. Cortisol makes you temporarily insulin resistant. That means the oatmeal you eat at 7 a.m. causes a much bigger spike in blood sugar than the same oatmeal eaten at 11 a.m. You are creating a pressure storm inside your vessels. The strategy is to push breakfast back by 2 to 3 hours. By waiting until 10 a.m. or 11 a.m., you allow your cortisol levels to drop naturally before you introduce calories. You give your arteries a break. Try this. Do not eat immediately upon waking. Hydrate first with 2 tall glasses of water to dilute the blood, making it easier to pump. Think of it as thinning the oil in your car before you rev the engine. Thick, dehydrated blood is harder to push, raising pressure. By hydrating and waiting until you feel true hunger, not just the habit of eating, you align your eating with your circadian rhythm, reducing the overall pressure load on your heart. Let's synthesize this into a clear picture of your future health. By removing the glass shards of glucose, we stop the tearing of the vessel walls, preventing new plaque from forming. By lowering insulin with eggs and healthy fats, we unlock the kidneys and flush the excess fluid, reducing the volume in the system. By adding potassium, we physically relax the pipes, increasing the diameter of the vessels. By utilizing the glucose dump, we bypass the pancreas and protect the endothelium. Imagine the difference in your system. Instead of a high-pressure, turbulent flow rushing through rigid, calcified pipes, you have restored a calm, smooth river flowing through flexible, healthy vessels. The pounding in your ears stops, the brain fog lifts because oxygen is finally reaching your microcapillaries. The swelling in your ankles disappears as your kidneys finally do their job. You are not getting old and falling apart. You are simply operating your biology with the wrong manual. And now you have the right one. Do not let a cardboard box dictate your longevity. You have the power to change the age of your vascular system, starting with your very next meal. This is not about deprivation. It is about restoration. It is about reclaiming the physiological function that is your birthright. I am an investigator and your advocate, but I am not your doctor. Always check with your medical team before changing your diet or medication, especially when you start seeing results. As your blood pressure improves naturally, your medication dosage may need to be lowered to prevent hypotension. That is a conversation you want to have. The body is a system. When you fix the fuel, you fix the engine. Take action today. Let's explore the science of the endothelium a bit more, because this is where the battle is won or lost. This single layer of cells is not just a wallpaper for your veins, it is an active, dynamic organ. When it is healthy, it produces a constant supply of nitric oxide. I mentioned this earlier, but you need to understand its power. Nitric oxide is a vasodilator. It signals the smooth muscle cells surrounding your arteries to relax. When they relax, the vessel widens. When the vessel widens, pressure drops. It is simple physics. But when you eat inflammatory foods, when you spike your insulin, and when you consume fructose that generates uric acid, you are actively shutting down the production of nitric oxide. You're turning off the body's natural pressure release valve. This is why the delayed start and the glucose dump are so effective. They create the environment where your endothelium can heal and resume its job of regulating your pressure for you. You don't need a miracle, you need nitric oxide. And you can't buy it in a pill effectively, you have to earn it by protecting the cells that make it. Consider the role of magnesium as well, often called the forgotten mineral in blood pressure control. While potassium relaxes the vessel wall, magnesium relaxes the smooth muscle cells themselves. It prevents calcium from entering the cells and causing contraction. Think of calcium as the constrictor and magnesium as the relaxer. In a diet heavy in processed grains and dairy, we get too much calcium and not enough magnesium. This imbalance causes the muscles around your arteries to stay in a state of chronic, low-level spasm. By switching to the rescue protocol, eating avocados, nuts, and leafy greens, you are naturally restoring your magnesium levels. You are telling your arteries chemically that it is safe to let go. I want to address a common fear, but what about the cholesterol in eggs? This is the zombie myth that refuses to die. We have known for years that dietary cholesterol has very little impact on blood cholesterol for the vast majority of people. In fact, your liver produces significantly more than you could ever eat. When you eat less, your liver makes more. When you eat more, your liver makes less. It is a tightly regulated system. The real driver of dangerous cholesterol, the small, dense LDL particles that get stuck in the arterial wall, is not fat. It is sugar. It is the oxidation caused by high glucose levels. When you eat the oatmeal, you oxidize the cholesterol. When you eat the egg, you provide the nutrients to manage it. Do not fear the egg, fear the toast you used to eat with it.
Let's talk about the afternoon crash. You know the feeling. You eat your healthy sandwich at noon, and by 2 p.m. you can barely keep your eyes open. You reach for coffee or a sweet snack. This is not fatigue. This is a metabolic crisis. Your blood sugar spiked, your insulin surged, and then your blood sugar crashed. This roller coaster is devastating for your blood pressure. Every time your sugar crashes, your body releases adrenaline and cortisol to bring it back up. These are stress hormones. They tighten your arteries and increase your heart rate. So even while you are sitting at your desk or watching TV, your body is in a state of fight or flight chemically. By switching to the fat anchor meal, fat and protein, you eliminate the crash. You eliminate the adrenaline surge. You keep your pressure stable all day long. We must also consider the role of hydration, but not just drinking water. It's about mineral balance. Drinking gallons of plain water can actually flush out your electrolytes, making the situation worse. You need structured hydration. This is why the potassium from the greens is so vital. It helps the water get inside your cells, rather than just sitting in your blood vessels, increasing pressure. When you are properly hydrated at a cellular level, your blood flows more freely. It becomes less viscous. Imagine trying to pump honey through a straw versus pumping water. High blood sugar turns your blood into honey. Hydration and low-carb eating turn it back into water. This reduces the workload on your heart significantly. I want you to think about your kidneys again. They are the unsung heroes of blood pressure. They filter 200 quarts of fluid every single day. They're delicate. The high pressure in your system hammers the tiny filters in the kidneys, causing scar tissue. This scarring makes them less efficient at filtering salt, which raises pressure further, which causes more scarring. It's a vicious cycle. The only way to stop it is to lower the pressure and lower the insulin. The rescue protocol is designed specifically to break this cycle. By lowering insulin, you give your kidneys a rest. You allow them to heal. You stop the hammering. Let's visualize the glucose dump one more time, because I want you to do this today. You finish your meal, you feel comfortable. Instead of sitting on the couch, you stand up. You might do a few calf raises while doing the dishes. You might walk up and down your hallway. You might step outside for a breath of fresh air. Inside your body, a miracle is happening. The muscles in your legs are contracting. As they contract, they squeeze the veins, helping pump blood back to the heart. But more importantly, they're opening those GLUT4 gates. The sugar from your meal is being pulled into the muscle to be burned as fuel immediately. It never gets the chance to stick to your arteries. It never gets the chance to spike your insulin. You have effectively neutralized the threat of the meal through simple movement. It is the most powerful free drug you have access to. Why is the delayed start so effective for the 55-plus demographic specifically?
As we age, our insulin sensitivity naturally decreases. We are not as efficient at processing carbohydrates as we were when we were 20. This is a normal part of aging. However, we continue to eat like teenagers. By pushing breakfast back, you work with your aging physiology, not against it. You allow your fasting window to extend a little longer. During this fasting time, your body engages in autophagy, a process where it cleans out old, damaged cells. This includes damaged endothelial cells. By simply waiting a few hours to eat, you turn on a cellular cleaning crew that scrubs your arteries from the inside out. I want to be very clear about the timeline. This is not a 30-day fix. This is a lifestyle shift. However, many people see changes in their fluid retention within 48 hours. They notice they are urinating more frequently as the kidneys unlock and dump the excess sodium. They notice their rings fit looser. Their ankles are less puffy. This is the water weight leaving the body. As the fluid leaves, the pressure on the vessel walls decreases. The number on the monitor starts to tick down. It is a physiological certainty. If you stop filling the balloon, the pressure must drop. Let's re-examine the whole grain myth. We are told that we need fiber, and we do, but we do not need fiber wrapped in a sugar bomb. The fiber in oatmeal or bread is bound to massive amounts of starch. To get 5 grams of fiber, you have to eat 30 grams of starch. It is a bad deal. You can get that same 5 grams of fiber from half an avocado with 0 starch and healthy fats that lower inflammation. You can get it from chia seeds or flax seeds. You can get it from leafy greens. You do not need grains to get fiber. That is a marketing lie designed to sell surplus crops. Your arteries do not care about agricultural subsidies. They care about inflammation. When you go to the grocery store next time, I want you to shop the perimeter. The center aisles are where the blood pressure spikes live. The boxes, the bags, the cans, they are loaded with sodium to preserve shelf life, yes, but they are also loaded with refined carbohydrates and seed oils. Seed oils like soybean, canola, and corn oil are highly inflammatory. They integrate into your cell membranes and make them stiff and dysfunctional. Your endothelium needs flexibility. It needs omega-3s from fish and healthy fats from olive oil and avocados. It does not need industrial seed oils that oxidize and create inflammation. By sticking to the perimeter, produce, meat, dairy, eggs, you automatically eliminate the vast majority of the specific offenders we discussed. Let's talk about the salt sensitivity myth. Some people are indeed salt sensitive, but for the majority of the population, salt sensitivity is actually insulin sensitivity in disguise. When your insulin is low, your body is excellent at excreting excess salt. You could eat a salty pickle and your body would simply flush the excess sodium out a few hours later. No harm done. But when your insulin is high, that same pickle becomes a problem because the exit door is locked. So the doctor tells you to stop eating pickles, but he doesn't tell you to stop eating the bread that locked the door. We're blaming the salt for the crime committed by the sugar. The lifestyle catalyst is not just about the glucose dump. It is about stress management. Chronic stress keeps cortisol high, which keeps insulin high. We live in a high-stress world. We cannot always change our circumstances, but we can change our response. Deep, slow breathing, specifically extending the exhale, activates the parasympathetic nervous system. This is the rest and digest system. It directly counters the fight or flight response. By taking 2 minutes before your meal to breathe deeply, you are telling your body it is safe to digest. You are lowering cortisol before you take the first bite. This improves digestion and reduces the insulin response. It is a small tactic with a huge payoff. I want to reinforce the concept of the fat anchor. This is the single most practical tool you can use. If you are at a restaurant and you cannot control the menu perfectly, order a side of avocado or eat the nuts in your salad first. Eat the protein and fat before you touch any carbohydrates. This physical layering of food in your stomach matters. The fat coats the stomach lining and slows down the absorption of everything that follows. It is a physical barrier against a glucose spike. You are engineering your digestion. Think about the legacy of this advice. For 30 years, we have seen heart disease and hypertension rates climb despite everyone trying to follow the low-fat, heart-healthy guidelines. If the guidelines worked, we would be getting healthier. We are not. We are getting sicker. It is time to look at the results and admit that the experiment failed. The low-fat, high-carb experiment has been a disaster for metabolic health. It is time to return to the way humans are designed to eat: whole foods, natural fats, adequate protein, and minimal processed carbohydrates.
You have the knowledge now. You understand the mechanism. You see the deception. The red heart on the cereal box is not a shield. It is a warning label. It warns you that what is inside will spike your sugar, raise your insulin, lock your kidneys, and cement your arteries. You know better now. You know that the egg is the antidote, not the poison. You know that the walk after the meal is the medicine. You know that the timing of your breakfast can save your life. This is a masterclass in reclaiming your autonomy. You are no longer a passive patient waiting for a prescription refill. You are an active participant in your own rescue. Every time you choose the eggs over the oatmeal, you are casting a vote for flexible arteries. Every time you choose the avocado over the toast, you are casting a vote for open kidneys. Every time you wait until 10 a.m. to eat, you are casting a vote for lower pressure. These are small votes, but they accumulate. Over weeks and months, they build a landslide victory for your health. Remember the warning signs. If your shoes feel tight in the evening, that is your kidneys asking for help. If you feel dizzy when you stand up too fast, that might be dehydration or medication issues. Check with your doctor. If you have a headache that won't go away, check your pressure. Your body talks to you constantly. The problem is that we have been taught to ignore the whispers until they become screams. We mask the pain with painkillers. We mask the pressure with pills. We mask the fatigue with caffeine. Stop masking. Start listening. The pain is information. The swelling is data. Use that data to adjust your protocol. I want you to succeed. I want you to be the person who goes back to the doctor in 6 months and shocks them with your numbers. I want you to be the person who has to have their medication reduced because their body is working so well on its own. This is possible. It happens every day to people who switch their fuel source. But it requires you to be brave. It requires you to go against the grain, literally and figuratively. It requires you to trust your physiology over the marketing on a cardboard box. This is your mission should you choose to accept it. Clear your pantry of the offenders. Stock your fridge with the rescue kit. Plan your delayed start for tomorrow morning. Set an alarm for your glucose dump after lunch. These are the tools of the trade. You are the engineer of your own biology. Fix the pipes, lower the pressure, save the system.